Okay, Steve. First question. If you had to describe the seminar in one sentence, in a nutshell, what is it about and what is the outcome for the students?
What it's about is, simply put, the impact of ideas on health and healing and happiness. And the outcome for students is their ability to guide their patients and their loved ones often to health and happiness using the techniques they will learn. The side benefit for them is that they can apply the same approach and techniques to themselves for their own personal development.
Wonderful. Wonderful. So everybody benefits, the students, their families, their patients.
Yeah, I believe that's true.
Steve, who is the seminar for and who isn't it for?
The seminar is really for the curious, people who want to understand how we work as human beings, the impact of our ideas, conscious and unconscious, on our bodies and on our sense of joy and fulfillment in this life. I would say if you care about yourself, if you care about your loved ones, if you care about your patients, you'll find something of high value in this seminar, for sure. Who is it not for? Of course, it's for people who don't care, who want to live within their insular world and go about their business without developing their talents or capabilities. I'm sure we won't see those people in this seminar. I look forward to seeing the healers come forth.
Wonderful. What do the students get out of it? What are 3 concrete outcomes for the students in terms of skills or tools or clarity?
Even before the skills that they will acquire, there needs to be a worldview and outlook that encompasses what our traditional science excludes. Materialism, reductionist science, excludes all things mental, all things mind. And so the first thing students will get is a broad of the role of ideas, conscious and unconscious, the role of mind in health and healing. They'll also learn techniques, both hypnotic trance techniques and waking hypnosis techniques that can influence the physicality of their patients, as well as the psychology of their patients. And they'll know how to address, lastly, specific conditions, common conditions, that they're confronted with on a daily basis with techniques that are both fast but also enduring.
What can students do differently or better in their work afterwards in practical terms?
In practical terms, the first thing students can do differently, and will do differently, I assure you, is listen. They will learn to listen in a very precise and specific way for hints at the noetic causes, the mental ideational causes of physical and mental illness. That's number one. And number two, they'll leave with a toolbox of treatments that allow them to address, not in some long protracted way, but with brief therapy, the illnesses and sadnesses that they encounter with their patients. They'll learn, in other words, they'll learn how to diagnose better and how to treat more efficiently.
Wonderful. What are the benefits for coaches and therapists that are already successful?
Yeah, this is one I want to talk to you about for a second. Okay. This is colored by my personal experience. I don't, other than treatment of short circumscribed ailments like phobias on the psychical side, and infection, say, on the physical side, between you and me, I don't see success. I see a world of failure, and so it's kind of a hard question because it presupposes success. So my answer tends to be, and I wanted to, before I say it, I wanted to see what you think. I think short-term is plentiful. It occurs frequently in both psychotherapy and in traditional allopathic therapy. But I think long-term success, meaning sustained health and happiness, is a rarity. And what they actually learn is how to deliver that, in addition to enhancing their short-term treatments.
What are the benefits for students that are already successful therapists or coaches?
In my experience, what I see as successful, generally speaking, are short-term successes. In allopathic medicine, for example, the presenting problem is treated and it resolves relatively quickly. In psychotherapy, again, the presenting problems are addressed and ameliorated. What I don't see is I don't see long-term health and happiness, sustained benefits. And what already successful professionals will get from this course is both an understanding and the tools they need to bring about long-term sustained health and happiness in their patients, regardless whether it's a psychological or physical malady.
You have almost answered the next question. How do the clients benefit?
How do the patients benefit? Well, if you pick up any chart in most of the offices around the world, whether they're treating physical or mental ailments, the charts are thick and they have records of we treated this, it got better, we treated that, it resolved, next one and the next one and so forth. And I call this blunt beginnings, they just happen, and endless endings. The reason for that, I maintain, is that the root causes of these illnesses are not addressed. And often these root causes are noetic or mental causes, ideas of various sorts that are deep, deep in the psyche of your patients. This course teaches you how to recognize those deep-rooted causes and how to treat them quickly and efficiently so that ultimately the chart thins and the patient has the experience of sustained health and happiness.
For which clients' problems does your method show the strongest impact?
Realize that the cardinal fact in medicine is that ideas, the placebo suggestion, can benefit patients suffering from virtually every condition known to mankind. Ideas matter. And what my method does is it refines the understanding of what ideas are causing the problem and what ideas will help to resolve those problems permanently. So I consider that across the full range of human maladies, these methods work. Now, there are frequently dramatic results on the traditional medicine, Western medicine side. I've seen many stage 4 cancers disappear, autoimmune conditions resolve, even very advanced organic heart disease resolve completely. And so those dramatic changes often wow people. But I've also seen, and I think it's equally important, I've seen people with a perpetual, unending sense of poor self-esteem, deep sorrow, abiding guilt, constant, unremitting anxiety. I've seen many, many patients with those kinds of disorders who break through quickly and begin to enjoy what Milton Erickson called your birthright, namely happiness. So I would say the benefit from these methods is across the board, and different people will put different emphasis on which or what is the most important, depending on the kind of patient they see.
Yeah. What becomes easier for the students as a result of attending a seminar?
What becomes easier for students might surprise you. What becomes easier is their ability not just to enjoy, but to actually love their work. It's a beautiful outflow from the enhanced understanding of human nature, of the nature of symptom formation, of noetic causes and cures. It's very easy, for example, to diagnose an infection, prescribe an antibiotic, and treat it. But there's very little personal satisfaction in that. It's there, but it's tiny. However, if you understand the contributory noetic causes of that ailment, why it happened that day instead of some other time, and maybe it's not an infection, maybe it's depression or organic heart disease of some form, or cancer. When you discover the causes of that and treat it, the gratification you personally receive is immense. I mean, it's really immense. You walk around the world with this quiet joy of achievement. You haven't done it yourself. You've done it in communion with your patient's innate capacity to heal, and you know it.
Wonderful. Wonderful. How gratifying.
Yeah, I'm really happy because I thought some of these answers you weren't going to like because they're not typical commercial answers. You know what I mean?
Mm. I like your honest answers.
Yeah,
Yeah.
yeah. Well, you're reminding me why I like you.
Steve, there are many trainings out there, trainings in therapy, etc. What is unique about your approach?
Well, let me say, no one is teaching my approach out there except me at this point in time.
Mm.
And what I've identified is a deeper, wider understanding of the causes of human suffering. And this program teaches practitioners how to discover those causes in their patients. Very, very simple techniques, but critically important and not taught or practiced broadly around the world at all, unfortunately, at this point in time. However, just learning the contributory noetic causes of someone's suffering is not enough. It's just the beginning. You have to also learn how to treat those causes. And that's what these courses offer. Methods for treatment, protocols for treatment, so that the patient deep source of illness is rooted out and disposed of permanently, and they can go on to enjoy a sustained health and happiness.
What an outcome. What an outcome.
Yeah.
Which common misconceptions in the field of hypnosis or therapy do you clear up?
The most common misconception that in these courses I clear up is the conflation of trance with hypnosis. This has been going on for hundreds of years, and it's tragic because what it disallows is an understanding of the true impact of ideas, trance or no trance, on the health and healing of those who trust us. And so we learn at the very beginning the why. Why do ideas in certain circumstances have such profound impact on people? And then we learn how to manage that profound impact by using it beneficially instead of harmfully by accident, and how to guide a patient, how to ignite their internal innate healing capacities to achieve their goals, whatever they may be.
Which technique or interventions do students learn, and what is it immediately applicable for?
In this class, we borrow methods from the hypnotic method, and we learn how to, one, establish rapport, and two, how to develop linkage. Rapport means I equals you and all the observable attributes. It's a method of mimicry that joins you with the patient in ways your patient might not overtly detect, but that brings you near in a kind of communion with them, and it empowers your words and ideas. Linkage is a way of making your words, using proper vocabulary and linguistic methods, making your words match their experience. At first, their experience now, but of course, then their experience later. And so you can carry these two techniques, you don't need trance, into a fast-moving office or an hour-long session, or in fact, anywhere in your working or daily life. And what do? They give power to your ideas. They enable you to more strongly exert the effect that you're hoping to exert when you're speaking just haphazardly without those techniques. It's in essence the core of noetic medicine, of ideas impacting health and healing.
Steve, what do colleagues typically say when they see your work? Like, how do you do that? Or what do they say?
It depends how close these colleagues are to me. Those who are remote but refer their patients to me they're often pleased and puzzled by the results. But it might surprise you, I rarely get asked, how did you do that? Those colleagues who are close to me, they're, of course, it's different. They're generally, they'll ask, how do you do that? Is that translatable, or is that some special gift you have? And what they discover with much less work than they anticipate is, no, it's not a special gift. These are translatable skills. And that's what this course is about.
Steve, what typical change have you observed in students before and after your seminar?
Well, let's face it, we all work hard, we study hard, we learn what we learn in our respective disciplines. But the truth is, we're all puzzled by the great mystery that surrounds the human condition. What I see is people emerging from my seminars with a sense of having, at least to some significant measure, resolve the mystery and broaden their understanding of how humans end up becoming sick, distressed, unhappy, sorrowful, and also of what they can do working with their patients or with their family or with their friend to change things, to turn that unhappiness or that illness into an opportunity for personal understanding and growth and a gateway to health and happiness.
Which types of cases do you have particular experiences with, and why is that relevant for the seminar?
Well, my experience is quite broad at this point. I've been doing medicine for 50 years, and I've done, and I'm board certified in family practice and in emergency medicine and in medical hypnosis. I've maintained a private practice for the last 40 years. And so I see patients with severe psychological disturbances and with frightening medical problems, ranging from the inexplicable to cancer of various stages to the full array of diseases and ailments we see in general practice. And I can say without question at this point, the techniques I'm teaching bear on the treatment of the full range of human suffering and enable practitioners to address any of those problems I've mentioned in a much, much more effective manner. And they'll know it as they do it. We all have a sense of not quite adequate. I didn't really hit it right. There's something missing. I don't understand the whole thing. And I can't tell you that disappears entirely because much of our world is mysterious. But I can tell you that much of the mystery about human health and healing dissolves with the understanding of how mind and body function and what interventions you can make in your own mind and body and in the patient's mind and body to bring about true healing.
Steve, what is the most common feedback after the seminar, after the basic seminar?
Let me first explain that most of us finish our training, whatever route we've gone, and we begin to see clients, and whether conscious or unconscious, we realize that despite all the hard work and study, there is so much we don't understand. You ask, what do students get from these seminars? What are their comments, generally speaking? And their comments are, wow, I finally understand. I have the missing piece. Thank you so much. That's my most common comment.
Yeah, I can confirm that.
Yeah, it's very gratifying.
Yes. Many people want to know what actually happens in the seminar. So how does the seminar run in terms of theory, practice, demonstrations, Q&As?
The seminar runs with both theory and practice. It's really important to understand that the causal notions that underpin traditional psychotherapy and traditional allopathic medicine are inadequate. Most of us have a sense of that, but it's not enough to say that our understandings are inadequate. We have to offer a broader, more applicable explanatory knowledge, and that's theory, and that's what the first part of the seminar will cover. and it carries through. But that in and of itself would have very little practical value. And so I teach and we practice how to translate that theory into normal day-to-day conversation, how to give informed consent, how to deliver bad news, how to understand the statistical and anecdotal information that we're confronted with on a daily basis, how to render care both without trance and with hypnotic trance induction. All of that is in this seminar, and it leaves people not with a set of skills, don't know why they work, but with a set of skills and understanding why and how these must work, and they do work.
Here are some questions we hear quite often. I'm already experienced. Is it still worth it? What is the added value at an advanced level?
This is another one of those where I thought, nah, he's not going to like this answer. I'm already experienced. What is the added value? That's the question. I would say you're already experienced, I imagine, at treating within the confines of your training, of your discipline. But to my knowledge, there is no training in any of the various disciplines that includes a broad understanding of the contribution of noetic causes, mental causes, to physical and mental illness. That's something that you really need to affect lasting cures. If you're treating something that's relatively short term, of course you can handle that. You've been trained to handle that. But do you understand why it happened that day instead of a week before or a year later? And do you understand that the answer to that question, if discovered, allows you to prevent illnesses in the future? That's really critical. If you're treating patients long term, I think it's fair to ask, does it need to be long term? Have you been taught that by your personal and professional training, as some schools teach? I would refute that. I have seen, and I know from my practical experience, that many patients who've been cursed with the notion of you'll just have to live with it, or stay with me and I'll help you survive this miserable life, or you have a chronic condition, implying there's no future cure. Many such patients resolve their problems with the kind of treatments that I'm teaching, and rather quickly. And so, of course, you're an expert in your field. What these courses do is broaden your field and thus broaden your expertise.
Some people say, I have little time. What's the fastest win I can implement after day one?
Well, I think it's important to understand that many of the techniques I developed and the understandings that I teach came out of my 20-year experience as an emergency physician in an emergency room where there was one doctor only, and the pace of the work was Mach speed. I had to find ways in which to make my ideas have a profound and lasting impact on patients without taking any extra time. And those are the techniques that we focus and concentrate on. It's very easy to give, for example, information like, say, informed consent haphazardly, and that can do damage by accident. It's equally easy to give it in the manner I teach it, in a way that diminishes the likelihood of a negative outcome and biases to a large extent the possibility of positive outcome. Almost everything I teach makes you more efficient, not less. If you're going fast, you don't have to slow down. You just have to do better. If you're going slowly, again, you can take your time, but with a broader understanding and a bigger toolbox.
Which mistakes do students avoid after the seminar, and what would it otherwise cost in terms of time, money, energy?
For the student, you mean?
For the students?
Until someone understands the impact of ideas on health and healing, how to structure your relationship with your clients and convey ideas effectively and efficiently through that structured relationship. Unfortunately, they will misspeak. They will convey ideas that are inadvertently harmful, no matter how compassionate they are. Those are the inevitable mistakes I see day in and day out being made by clinicians of all stripes. And that's what goes away when you take these seminars. You learn how to do it right. Because remember, no matter what your practice, you're always delivering ideas. You're offering a treatment approach, a prognosis, a diagnosis. And all of that entails language and nonverbal communication. Done wrong, we know from all the nocebo studies done over the last over 125 years, we know that harm can be done by that. Negative suggestions produce negative outcomes. It's simple as that. But we also know, and you will discover in this course, that positive suggestions can induce extraordinary positive outcomes, outcomes that you haven't been taught are even possible, and yet which I witness on a daily or weekly basis.
Okay. Steve, what is we're talking about the basic
About
seminar,
what?
the basic seminar.
Okay.
What, Steve, what is the most important reason for you to teach this seminar? And why is it especially important right now?
I'm very, very fortunate. I tell this to my patients. In my office, in my private practice, I get to witness miracles, quote unquote miracles, on a weekly basis. I see stage 4 cancers literally disappear, and not one or two, and not a handful, but many more. I see so-called incurable ailments or chronic diseases resolve or regress tremendously. And I see awful, awful psychological maladies resolve and disappear so that patients are finally capable of enjoying life and health and happiness. The reason I teach is because I don't want these miracles I witness to be occurring in one tiny little office somewhere in San Diego, California. I want my colleagues, I really want my colleagues to revel in the same joy I do as they assist their patients in bringing about, as I say, health and happiness, lasting health and happiness. And it's the gratification of seeing my students witness the miracles I witness that compels me to continue teaching.
Yeah. Wonderful, wonderful answers.
Well, that part is really true. This book I was telling you I'm writing the foreword on, this is a student of mine here who I saw for horrible metastatic prostate cancer to the bones and lymph nodes. And his doctor cursed him with, you can't cure prostate disease ever. That's what he was told. And he did traditional but also noetic medicine and resolved it, and then wrote one of the most beautiful books I think I've ever read on health and healing. It's really gorgeous. And for me, I'm sure you can feel this, is like, good, great, Greg. I'm glad you're cancer free, and I'm glad you're out there teaching and everything. But wow, you just gave real meaning and purpose to my life. It's like, thank you. I appreciate your gratitude. Thank you.
Yeah.
That's really key. When you get to be my age, you'll understand that even more.
Okay.